Hello, my name is Sylvia Chan, and I am the director of the Revere Cares Coalition in the city of Revere. Today with me are the leaders of 3 neighboring communities, Mayor Brian Arrigo of the city of Revere, City Manager Tom Ambrosino from Chelsea, and Town Manager Austin Faison from Winthrop. There's a new collaboration between these 3 communities and between the healthcare systems that serve the 3 communities and other community organizations such as the neighborhood developers, other coalitions like Healthy Chelsea, and CAPIC. And new residents that live in these 3 communities also have an important role to play. Stay with us and hear more. Hola, mi nombre es Silvia Chiang y soy la directora de la coalición Revere Cares en la ciudad de Revere. Conmigo el día de hoy están los 3 mandatarios de comunidades vecinas. El alcalde Brian Arrigo de la ciudad de Revere, el administrador Tom Ambrosino de la ciudad de Chelsea y el administrador Austin Faison de Winthrop. Hay una nueva colaboración entre estas 3 comunidades, entre los sistemas de salud que sirven a estas 3 comunidades y entre organizaciones comunitarias como the Neighborhood Developers, otras coaliciones como Healthy Chelsea y CAPIC. Y ustedes, personas que viven en estas 3 comunidades, también tienen un importante papel que jugar. A continuación voy a hacer esta entrevista en inglés, pero al final voy a hacer un resumen en español. Así es que por favor, quédese con nosotros y escuche esta importante información. So hello again and welcome. Almost all hospitals in Massachusetts are required every 3 years to examine the communities they serve and their most important health needs. We call this the Community Health Needs Assessment. With the results of this process, then they need to come up with a plan. And we know this as the Community Health Improvement Plan. For the first time ever, the 3 communities, Revere, Chelsea, and Winthrop, have decided to run this process together in one integrated, comprehensive regional health assessment. So, Mayor Brian Arrigo, how are you?
I'm doing well.
Good. So tell us a little bit more specifically who is involved in this project.
So the North Suffolk Public Health Collaborative was an agreement that the 3 communities had signed a couple of years ago with the help of the Metropolitan Area Planning Council. The 3 communities have been together in negotiation to think about how public health issues can be dealt with on a regional level. And so the City of Revere, the town of Winthrop, and the City of Chelsea got together and are part of this collaboration, including also hospitals, which is obviously an important part of this conversation. Mm-hmm. So we have Beth Israel Deaconess, Melrose Wakefield Hospital, Mass General, of course, and we look forward to working with our partners on the health side to make sure that there's public policy that we can implement.
Yeah, that's great. And Tom Ambrosino, so who else needs to be involved in this project?
So we're trying to reach some stakeholders who often are hard to reach: the homeless, uninsured, elderly, immigrants. And so in addition to the hospitals, we're also reaching out to social service agencies that have access to these populations, places like North Suffolk Mental Health, CAPIC, Mystic Valley Elder Services, ROCA, and trying to bring them in so that we get input from some of these hard-to-reach populations.
Yeah, wow, that's great. So why are so many people collaborating, all 3 communities and all the health providers, Town Manager Faison? Why is this project so important?
So we kind of use this phrase frequently that health needs have no borders. There is nothing necessarily unique about the health problems of our individual communities. What we're looking at is we're taking a regional approach because we are impacted by things like the opioid crisis and the airport equally, and we're taking this as an opportunity to work collaboratively on a regional basis, similar to a lot of other places in the country. And in addition, instead of us individually seeking funding for our health needs, we can collaborate as one larger entity and seek larger amounts of money to kind of pursue policy interventions that we would like, and also secure the funding for the important programs that we're trying to partake in our individual communities.
Yeah, that's great. Thank you. So, Mr. Ambrosino, given your long-term experience as a community leader, you in the past have been the mayor of the city of Revere, now city manager of Chelsea. Can you give us an example that would illustrate what this process has produced in the past?
Yes, so the goal of the process is to identify the public health priorities in the region. And in the past, once we've identified those priorities, then we've gathered coalitions and collaborations to address them. So for example, in the 2009, Chelsea did such a health needs assessment. It identified obesity, and particularly child obesity, as one of its high priorities. And from that identification, the Healthy Chelsea Coalition was formed to really address that. And they worked over the ensuing years to work with the school department on healthier foods in the cafeteria. They worked with the city on providing better recreation space to get people to exercise more. Several years later, in the next health needs assessment in Chelsea, substance use disorders was identified, and so Healthy Chelsea, that same coalition, started to work on addressing that problem. I expect that at the end of this process, there will be a prioritization of needs, and either existing coalitions or a new collaboration might take place to address that.
I see. Very nice. So, Mayor Rigo, what does Revere hope to gain from this big three-community assessment project?
So obviously we want to work together with our neighboring communities and think about the public policy implications that the needs assessment will have. But it also gives Revere an opportunity to think about our master planning process and how the work that's being done on this regional level can kind of be an input to what we do and how we look at the city going forward for the next 20, 25 years.
That's great. Okay. And Mr. Faison, you're relatively new at this point as a town manager, but how might this process be of value to you?
So on the first hand, working regionally is very important to me, and seeing a collaborative process move forward, I'm very excited to engage in this process. That said, I want to know the health needs of Winthrop and what makes Winthrop great, but I also want to know the specific health needs of Winthrop as well. And I think that we can extrapolate some of the health needs by looking at the communities that surround us as well. Mm-hmm. So it's a very exciting opportunity to work across a region and look for good health solutions in the long term for Winthrop, because similar to Revere, I'm looking to do a longer term Winthrop 2030 plan, and I would love to have the opportunity to have some health indicators in that plan, some aspirational numbers to look for.
Oh, good. So please tell the residents of Chelsea, Revere, and Winthrop, Mr. Faison, how can they contribute their knowledge and their experience in the community to this assessment?
Sure. So directly at the camera now. There's a multitude of different ways to get involved. The information is on all of our individual websites. We are running things on our local cable access channels as well, and in our local papers. More importantly, though, there is a website called northsuffolkassessment.org where you can go and learn more about this program and also participate in the survey.
Yeah, I also know that on that website, residents can sign up to get a newsletter that will keep them up to date, and then learn also when there's some community meetings where you can go personally and voice your opinion. There will also be focus groups and interviews in the next few months to gather more health information around these communities. So, Mr. Ambrosino, sometimes actually people are afraid to share information. How are you handling this?
Yes, so in addition to focus groups and getting involved in meetings, you can take an anonymous survey, and I would encourage all residents, and if you just live work in the communities as well. You can either live here or work in any of our communities to take part in an anonymous survey where you are answering questions, but no one knows your identity. And we encourage people to look on our websites and answer that survey. And in fact, if you answer the full survey, you will be put in a pot to potentially win a $50 gift certificate to Market Basket. So there is some potential benefit to you from doing the survey, but you can remain completely anonymous.
Yeah, that's great. Thank you very much. So, wrapping up, Mayor Arrigo, what would you like to say to our viewers?
I just want to make sure that everyone, and encourage everyone to fill out the survey, get involved. The more people that participate, the better the information that we
That's
have,
right,
and
yeah.
ultimately the better decisions that we can make as the leaders of our communities. And so I encourage everyone to check out the website and be able to fill out that survey.
That's great. Well, then thank you very much, and thank you all of three of you for having this great conversation and promoting the health needs assessment. So more information about the process and the survey can be found at the address on the screen. Please take the time to give your input and let your voice be heard. Ahora voy a hacer un resumen de esta plática en español, if you bear with me. Entonces le vamos a explicar que los hospitales de Massachusetts tienen la obligación cada 3 años de examinar las comunidades que ellos sirven para determinar las necesidades de salud. Por primera vez en la historia, las 3 comunidades de Revere, Chelsea y Winthrop se han unido en una colaboración que se llama North Suffolk Public Health Collaborative. Y han unido los sistemas de salud que sirven estas comunidades y nuevamente a esas organizaciones comunitarias como The Neighborhood Developers, Healthy Chelsea y CAPIC para conducir una evaluación regional, integrada y comprensiva. El mandatario Arrigo recalcó que la importancia de compartir esta información entre las 3 comunidades y todos los hospitales de la región es para poder enfocar de una mejor manera los recursos y atender las prioridades verdaderas de estas comunidades a nivel regional. El administrador Ambrosino nos recordó lo importante que es que todo tipo de población participe en aportar esta información. Necesitamos escuchar de todos, de personas especialmente que están teniendo necesidad de encontrar vivienda, aquellas personas que tienen dificultad en encontrar seguro médico, los inmigrantes de esta región. Es muy importante que ustedes también participen. El administrador Faison nos recuerda que los problemas de salud traspasan las fronteras entre ciudades, pero trabajando juntos podemos dar más poder para adquirir fondos monetarios y encontrar soluciones a nivel regional. También podemos contemplar hacer cambios a nivel de regulaciones y reglamentos que afectan o determinan la salud. Los 3 hablaron un poco de cómo se puede participar y de la importancia de participar. Así que nuevamente puede ir al sitio web www.northsuffolkhealth.org en la pantalla y ahí se completa una encuesta que se encuentra en 4 idiomas, en inglés, español, portugués y árabe. El administrador Ambrosino nos recalcó que la encuesta es anónima y no debe de temer de compartir información. Si desea, es opcional, puede incluir un correo electrónico o un número de teléfono y eso le permitirá participar en una rifa de una de 6 tarjetas regalo de $50 para el supermercado Market Basket. En el sitio web también encuentra el horario de sesiones comunitarias donde usted puede participar si quiere dar su voz a nivel personal. También puede suscribirse a un boletín informativo que lo mantendrá al día de cómo va el proceso, de los resultados y en el futuro del plan que se va a hacer con los resultados de este proceso. El alcalde Arrigo nos enfatizó, entre más participación hay de parte de todos los residentes, la calidad de información es mejor y eso conduce a que de veras se resuelvan las necesidades de la comunidad. Vamos. Ingrese al sitio web y llene la encuesta. Su opinión cuenta. Gracias.